Live, local, late breaking. You're watching KOLD News 13 live at 10.
Catastrophic and egregious, just two words a medical expert used to describe Arizona's prison healthcare system in the federal trial of Jensen versus Shinn.
Prisoners argue their health care is so bad within the Arizona Department of Corrections, Rehabilitation and Reentry, it violates their constitutional rights. Investigative reporter Shaley has followed the case for years and breaks down the latest from court as week 2 of the trial wraps.
The last 2 weeks has been a pretty intense presentation of our case.
Corrine Kendrick is the deputy director of the ACLU National Prison Project. She is one of the trial attorneys fighting on behalf of inmates in Jensen versus Shinn.
The medical and mental health care continues to put a lot of people at serious risk of harm. People are dying, preventable deaths, including deaths by suicide. And the staffing at multiple prisons, including the Tucson facility, is inadequate.
Her team put medical expert Dr. Todd Wilcox on the stand. Wilcox has toured Arizona prison facilities and reviewed the medical records of inmates for years. Here is how he described his 3-day visit to the Tucson complex in 2015. Quote, ADC prisoners continue to suffer serious harm and in some cases preventable death because defendants fail to provide necessary and timely health care on a system-wide basis. He went on to say the system is obviously broken and human suffering is the unavoidable result. We cannot record anything in federal court, but when Wilcox took the stand, he did spend some time talking about the case of a young man housed right here in Tucson. It's something I talked to Kendrick about.
So Dr. Wilcox described in detail in both his written statement to the court and then in his testimony about a young man who had a very concerning lump on his testicle.
That inmate was in his late 20s when Wilcox first met him and described the delays in care as unconscionable. Wilcox said the Tucson inmate died this year on June 10th at the age of 30.
And he explained that that is one of the most common and treatable forms of cancer if it is caught early and treated. It has over a 95% survival rate. And this is about the 4th or 5th young man that Dr. Wilcox has encountered in the years working with us where alarming symptoms in a young man of possible testicular cancer were ignored or disregarded, and ultimately the patient either passed away or had suffered from cancer that spread greatly throughout his body.
On one of Wilcox's tours to an Arizona prison, he said inmates received grossly deficient care in 37% of the medical records he reviewed. He went on to say, tragically, in 11 cases, it is likely that the patient would have lived had he or she received timely, adequate care. In this declaration, Wilcox called the Arizona system dysfunctional and dangerous. Shaley, KOLD Investigates.